So I want you to just imagine your day when you wake up. First off, are you sleeping in bed properly? Sleeping in bed, if you're laying on your back, you want to keep your knees lifted up, laying on your side, pillow between the knees, and never laying on your stomach. That can cause a lot of stress on the lower back. So you could be sleeping wrong. Then getting up out of bed wrong. When you're cold, you swing up out of bed, putting stress on your back. Then you say you get up and you stretch first thing in the morning. You think you're doing your body good, but you're actually causing more pain because you want to be warmed up and loosened up before you stretch. Twisting for relief, or twisting in the shower because your back is tight and you want to feel secure. But actually, when you feel secure or you put fear in yourself, that's the perfect time to get injured. Brushing your teeth, people leaning over and putting stress on their back when they should be either putting their hand on the table to take stress off or sitting up nice and straight and looking in the mirror. Tying your shoes, getting in the car, sitting. So you can see all these repeated things that we do daily that can cause small little problems, small little tears, and over daily and continuously can lead to major back issues. So we fight against the devil every day. So trying to keep our posture perfect, trying to keep our core strong, so on and so forth. So we want to prevent these micro traumas and get oxygen and nutrients to that damaged area. So we don't want that to occur. So what does all this mean? Basically, when this is happening and you're trying to protect your back or you're trying to stay in that position so you don't feel pain, it's causing a lack of neuromuscular connection. So you're getting less of a neuromuscular connection, which is your brain connecting to your body, as well as motor control. And almost 100% of our clients were totally disconnected from their lower back and deep core muscles. What that means is they were not sending any impulses to the core musculature and the injured area that supports the spine. For example, when they go to make a movement, they're actually protecting the area that's injured, and they're not sending any impulses, and the body bypasses the injured area, so it's deactivated and it gets no use. And over years of not having use, it creates an injury, it creates blood flow. So your neuromuscular system and motor control, the best analogy that we have here is like internet connection. So a good neuromuscular system and motor control is like high-speed internet. Bad motor control in the neuromuscular system is like dial-up. Remember the days of dial-up where you heard the dial tone and it would take forever to log on, the signal would break up constantly. So we don't want this. We want a smooth electric signal being sent to the body through our back muscles and to the rest of our body so we can function properly and get a strong core. So these impulses can be blocked. So when you have the dial-up, it could be blocked by knotted fascia, trigger points. It could be done by an injury or damaged tissue to the nerves, ligaments, tendons. And it can cause your muscular system to be totally dysfunctional and incompetent. So what happens is we need to be reprogrammed. We need to reprogram how our body functions and actually how we think about things. So we want to send impulses to the injured area and inactive muscles to reset the pain signal. And we want to balance out the muscular imbalances that we have. So we want to break down bad movement patterns, correct and create new patterns by activating weak muscles and stretching the tight muscles. So we want to release those fibrous knots that I talked about that could be causing that impeding process of the neuromuscular function that's been causing dysfunction and blocking impulses. So improving that speed of connection and involving the brain 100% throughout the movement. So really thinking, becoming connected with your body and your back. So why doesn't your doctor tell you this? Well, your doctor doesn't know. They're only taught to treat symptoms. They're only taught about the Band-Aid approaches. And sometimes they're not really concerned with fixing your back. I hate to say that, but they make money off you coming back and also buying medication. They don't have a solution because the back and body is also very complicated, and it's like a jigsaw puzzle. And it takes years to understand. Also, the US healthcare system is designed to just rush as many patients in and out as possible so they can make money and they can get you hooked on medication. And I don't want to say that's everybody, but in our experience, that has happened many times. But the good news is we created a lifelong solution. So the secret to lifelong pain relief, in order to get relief for the rest of your life, you got to start from the source of your pain. Makes sense, right? So you got to start from that source and then work your way out. You can't just cover it up with a Band-Aid approach. So for back pain relief, you want exercises that break down those knots. They transmit signals through the blocked area, and you warm up before you do these. So, another reason, no one cares more about their back than you, right? So, wouldn't you be empowering with the knowledge to eliminate your back pain? Would that not be the best scenario for you? I would think so. So, now I'm going to go over 4 movements that you can do immediately to get relief. And these are just a few simple things. So, and we have this also on our blog. So, knee side dropout. This is where you're laying flat on the floor and you drop your knee out to the side. So if you see this picture here, you drop it out. It's going to stretch your inner thigh. It's going to activate your glute medius. It's going to open up your SI joint, which is where the sacrum and the pelvis and the lower back meet. It takes pressure off the joints in the injured area. It creates a new pattern by activating the weak and injured area and affects the lower back right away. It activates the lower back and relieves pain. Number 2, so deeper activation of core muscles, those deep muscles that I talked to you about, the deep core. You want to bring your right knee into your chest. Then you're going to circle it around, so drop it out, just like similar to the first movement we just did, without touching your foot to the ground, and then kicking the leg forward. So just repeating that movement, it's going to loosen up the hip flexors, the hip rotators, and instantly take pressure off your lower back again. Number 3, now this is a PNF or static stretching movement, and it's going to correct that pressure that's on your lower back. It's going to take that pressure off the lower back. So you want to sit almost like in the butterfly, if you know what the butterfly is, but it's a little bit different. You want to focus on your lower back. You might feel your inner thigh a little bit, so just move your feet forward. You're going to kind of sit up straight, pull your body forward, pulling on your toes. And bring your forehead towards your toes. Again, it's going to release pressure off the discs in your lower back. Now we got the seated jackknife. Similar to the sit and reach, there's a lot of details here that you want to focus on. So your feet are completely straight, knees locked completely. You're going to reach for your toes as far as you can. You might not be able to reach them. And bring your forehead down as close as you can to your knees. So you want to do those 3 sets for about 8 reps and hold the stretching for about 10 seconds or so. So, the back pain relief for life formula. What we just showed you were some easy stretching techniques and exercises just to loosen up. But what we did was created a specific formula. So it's specific step-by-step movements done in a specific way that actually relieves all the pain and continuously. So there are 8 specific and easy to follow steps for loosening up the tight muscles and strengthening the weak muscles. We take you step by step through this program. It activates the synovial fluid, which is responsible for bringing the nutrients to your lower back so it can recover. 7 of the exercises are just laying down on the floor, so you don't have to worry, am I going to be picking up weights, or am I going to be bending over, or am I going to be doing, no, you're just laying on the floor, hands down on the floor, back on the floor, simple as that. The last one, you're going to be sitting in a chair.